Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about a hotly debated question about is physical therapy absolutely necessary after knee replacement surgery? Hey everyone, Dr. Luke Peterson here. So in this video, we're talking about is physical therapy necessary? Is it absolutely 100% necessary after your knee replacement surgery? And so just to give a little background, so obviously the traditional thought is someone has a knee replacement surgery, you go to the hospital, you have your surgery, you're in the hospital for probably 2 or 3 nights, and then you're discharged home after surgery. And then in that case, you either start home physical therapy, home services, or you transition straight to the outpatient physical therapy setting. You have physical therapy for a number of weeks, probably 2 to 3 times per week for, say, anywhere from 6 weeks to 8 weeks to maybe 12 weeks or a little bit more, depending on your circumstances. And then you're discharged and you go your merry way on with your new knee replacement. Obviously, this has changed a lot over time. So, of course, now there's the growth and the increase of ambulatory or same-day outpatient knee replacement surgeries, where you're having the surgery and then going home the same day. There's an increase in virtual services, so telehealth physical therapy, having services online from your home, things of that nature. And there's also the growth of some surgeons who give you a website or a booklet or a pamphlet or whatever it may be of things to manage your knee replacement, exercises to do, and things to be aware of, and reach out to them if you have any problems, but otherwise go ahead and do these exercises, do these activities, and you'll be fine in a couple of weeks, a couple of months. So there's kind of a spectrum of surgeons and healthcare professionals and patients who, physical therapy is necessary for a number of weeks, multiple times per week, to physical therapy is not necessary at all. And I would say that for some individuals, probably in my thoughts, for the majority of individuals, physical therapy is very appropriate and very beneficial, and I could even go and say necessary after knee replacement surgery. I wouldn't say for all individuals, so I think there are a certain subset of people after knee replacement surgery who they might be very healthy, they're very driven, they're very type A, they have some level of experience with exercise and physical activity and know what to do, that they can go home after surgery with, if it's a video, videos online, if it's a pamphlet or a booklet, whatever it may be, and they can basically go through, do the exercises on a regular basis, on a daily basis, manage their symptoms through icing and walking and all sorts of things, and basically can recover more or less on their own with that little bit of guidance through the materials provided by the surgeon or a physical therapist or who have you. And then moving from there, you might have those individuals who can do all those things, but maybe they might need that little bit more of guidance. So maybe they have a consult with the surgeon once a week or every other week. They have a consult with the physical therapist or a virtual telehealth visit or an in-person visit maybe once a week or once every other week. And then just with that little bit of guidance, that little bit of knowledge and information from the therapist, from the surgeon, they're able to then go on their way and recover in that respect as well. And then I think on the opposite end of the spectrum, you might have an individual who just, they have a ton of pain, you have a ton of deficits in your mobility, and you just don't have very much experience with performing exercises, with physical activity. Maybe you just don't have good consistency with it and you need that physical therapist or someone to coach you and to tell you what to do and that you have to do it and you need to do it and it's important that you do it. So for those individuals, which tends to be more so in the higher proportion of people, I think, at least at this point, is they need that physical therapy service. Do they need it 3 times a week for 12 weeks? Probably not. I think more and more we're trying to move away from that fee for service. So obviously, every time you see a physical therapist, that's how they get paid. So if you see a physical therapist, 20 times, they're going to get paid more money than if you see them 10 times. So that's kind of a limitation of insurance and of our current system. A lot of people, though, I think, once they get the instructions of what to do, with exercises, whatever it may be, with pain management strategies, typically, if that individual sees a person maybe once a week, maybe once every other week, start out a higher frequency shortly after surgery, maybe start out twice a week or 3 times a week, and then kind of cut it down to once a week to once every other week. I think that can be a very effective way of managing someone after knee replacement surgery and can still lead to really effective and really beneficial outcomes. The thing is, of course, there's those limitations of what your insurance can cover, what your insurance will say is going to cover. If you're not coming to physical therapy as frequently, they might not want to cover that and provide that insurance coverage, and then in that case, you wouldn't want to do that. But I think more and more, as I start to ramble here, there's different strategies out there. There's no one-size-fit-all approach for your rehab and your recovery after knee replacement. I think it depends on, what's your level of physical fitness and what's your level of function, what's your pain levels at, are you a type A person, or are you someone who needs someone to push you and to help you do the exercises or maybe provide that manual treatment as well? Do you have a support system at home? What are you trying to get back to? What are your expectations of your recovery from surgery? All these things kind of play a role. So I think it falls on a spectrum. There might be that small subset of people who really don't need physical therapy. They can get their exercises from their surgeon or the physical therapist or online and maybe consult with them every once in a while, but otherwise they're on their own. On the other end, there might be those individuals, and I think there is those individuals who need physical therapy frequently, 2 or 3 times a week for a number of weeks, and then you kind of start to taper that as you get better and better. So is physical therapy absolutely necessary post-surgery, post-knee replacement surgery? I'd say not necessarily for everyone. I think for the large majority of people, it is beneficial and is important for a good outcome. For some people, they might need some more and more frequently. For some people, they might need a little bit less, just a little bit of direction and consultation, and they can go from there. I'd love to hear your feedback, your questions, your thoughts on this topic. I'm sure there's different opinions out there, and I'd love to hear them. Thank you very much for watching, everyone. Have a great rest of your day.